Well, good morning, everybody. As you said, I'm John Dygert from Pinnacle Advanced Primary Care. It's great to be here. Thanks for having me. I was thinking about it. It's been 3 years since I last spoke at A Million Cups. And 3 years ago was Pinnacle's first year. We've been through a lot of blood, sweat, and tears since then. I'm sure a lot of you have as well, but hey, here we are. And also 3 years ago, I didn't truly believe that the healthcare system in this country was fixable. But now I'm 100% certain that it is, and we're going to talk about why. A month and a half ago, Brian Thompson, who's the CEO of United Healthcare Group, was assassinated. He was shot in the back, point blank, on the streets of New York City by a coward. Over the next few days, I was kind of astonished because I encountered several people who seemed to be on the side of the killer, like he was Robin Hood or something. Now, this warrior for healthcare reform was eventually caught, ironically out of McDonald's, and he had a manifesto, and it had exactly what you'd expect in it. It was railing against the healthcare system. It was talking about how insurance executives were parasites and that they deserved this kind of violence, that they had it coming. And he was complaining about how United had too much money and too much power and wow. It's very sanctimonious, actually. Starkly missing from this manifesto was anything that approached a proposed solution to the healthcare system. I mean, the dude himself acknowledged that the problem is complex and that he didn't pretend to be the most qualified person to lay out the full argument. So he's just mad. And because he was so mad, in his mind, that justified murder. Now, I criticize United Health like all the time, like on the daily. And there's plenty of reasons to be frustrated with the healthcare system. It is the number one cause of personal bankruptcy. We pay twice as much as any other country per person for healthcare, and more all the time, and we're getting less in return. Our life expectancies are declining, and chronic disease rates are soaring. So it's a problem. Like, I will acknowledge that a lot of our healthcare system is kind of trash. It is the worst of both bureaucratic worlds. Crony corporatism mixed with meddling government intervention. And, well, in spite of that, well, actually, because of that, is the reason I know it's actually fixable. Because the reason it's so screwed up is because the pricing mechanism for our healthcare system is completely opaque. And when an entire economy operates under the shroud of secrecy, this is what happens. A bunch of self-interested middlemen and bureaucrats line their pockets with your dollars. And that's what's happening. And there are so many people with their fingers in the pie, but all of them fit under one of these categories: carriers, pharmacy benefit managers, brokers, fraudsters, and hospital administrators. So that's what's going on. And that's the bad news. But the good news is the solution to this problem is staring us right in the face. Because if a lack of transparency is the problem, well, then radical transparency is the solution. And the people who believe in this transparency can accomplish amazing things. Let me just give you a few success stories, just a few people that we've met along our journey. Marilyn Bartlett, she was an accountant, little 4-foot accountant, that took over the health plan for the state of Montana, the employees of the state of Montana. So it's public sector. And she saw what was going on and she was like, oh no. And then she demanded price transparency and the ability to negotiate, and saved the state of Montana and their taxpayers $112 million just through that. Dave Chase is a former Microsoft executive who orchestrated a movement that's saving employers up to 40% on their healthcare spend with better insurance products. And then on the clinical side, kind of our personal hero at Pinnacle is Dr. Marty McCary, who's a staunch advocate for price transparency, for direct primary care, and for clinical excellence. And he's about to be your next commissioner of the FDA. So these people are innovators. They are disruptors. And that's why I'm so happy to be in a room like this, because it's full of entrepreneurs, just like those individuals. Entrepreneurs are the people who find the actual solutions to the problems. And they're always looking for a better way, a faster way, or a cheaper way to do things. And in Pinnacle's case, we accomplish all three. So all of you, keep fanning the flame of your dreams. And if you could do one thing for me, help all of us at Pinnacle spread this message of healthcare reform far and wide. It could help so many people. Thank you so much for having me.